fertility specialist with his 27-year-old wife. They have been trying to conceive for more than 13 months but have been unsuccessful. The husband has no previous children, but the wife has 2 children from a prior marriage. Their past medical history is unremarkable except for repeated sinus infections and a chronic cough in the husband. Physical examination reveals a point of maximum impulse located at the right fifth intercostal margin. What is the most likely diagnosis? The fact that the wife has had prior children suggests that the cause of the infertility lies in the husband. Given the history, Kartagener Syndrome is most likely. This is a genetic disorder with an autosomal recessive inheritance pattern. What is the cause of their infertility? Abnormality in dynein, which is an adenosine triphosphatase that acts as a molecular motor and is responsible for retrograde transport of material along microtubules. In addition, it is required for movement of cilia and flagella. If this enzyme is not functional, it results in immotile sperm. What is the cause of the husband's recurrent sinus infections? The cilia of the respiratory epithelium require functional dynein for motility. Without it, they are unable to transport bacteria and particles out of the respiratory tract. The retained particles and bacteria can lead to infections as well as chronic cough with sputum production. What abnormality might be observed on an X-ray of the chest? Situs inversus, which on the chest X-ray, the heart is found predominantly on the right side of the thorax. It may also show bronchiectasis with signs of dilated bronchioles. What condition is caused by a mutation in microtubule polymerization? Kartagener syndrome is an autosomal recessive disorder caused by a defect in microtubule polymerization, resulting in impaired migration of immune cells, such as neutrophils, and impaired lysosome function, which results in large granules visible within the cytoplasm. These both contribute to immune deficiency. Patients present with recurrent bacterial infections with staphylococci and streptococci. There are a number of antimicrobial drugs that inhibit microtubule function. What are some examples? Mebendazole and related drugs inhibit microtubule activity in helminths. Riboflavin is an antifungal that acts on microtubules. A number of chemotherapeutic agents also interfere with microtubule function, such as vincristine, vinblastine, and Taxol, such as paclitaxel.